Hi, this is Dr. Nadir Coles, and I wanted to go over a brief overview of COVID 19 as well as the vaccines that are now available to us. Here's a great video that I found on YouTube. I'm going to just share it with you guys. Again, it gives us a great overview of some of the preventions and precautions that we do have in place and that are recommended to remain in place until everyone is vaccinated and we get a hold of this COVID 19, as well as now the new variants that are out there. So please watch. Please bear with my slow internet connection. The video is buffering.
Hello, welcome to Emmy. So, what is COVID 19? Coronavirus disease 2019, also called COVID 19, is caused by a virus that can be passed from person to person. It first appeared in people in December 2019 and has quickly spread around the world. COVID 19 affects your respiratory system. In some cases, it can cause problems with your lungs, like pneumonia. There is a lot out there about COVID 19. Guidelines and recommendations are changing quickly as we learn more about the virus and how it acts. Trying to keep up with what to do and what not to do can be confusing and overwhelming. So let's break it down. Let's talk about what is going on and what practical steps you can take to keep you and those around you safe and healthy. How does COVID 19 spread? The virus is spread through droplets. So when an infected person coughs or sneezes, they project droplets of the virus out into the air. Those droplets then land on or are breathed in by other people. That's the most common way the virus can spread. Another way it can spread is when those infected droplets land on surfaces like door handles and elevator buttons. If a healthy person touches the surface that has droplets on it and then touches their eyes, nose, or mouth, it's possible for them to get sick. These are gateways for the virus, so the less you touch them, the less chance there is for the virus to enter your body. That's why everyone keeps saying, don't touch your face. If the virus gets on your skin, like on your hand, you want to wash it off by using soap and water or hand sanitizer before it reaches your eyes, nose, or mouth. It may be possible for a person with COVID 19 to pass the virus to others when they aren't showing signs of being sick. This is called asymptomatic transmission. It often takes 2 to 14 days before people start to feel sick after being exposed to the virus. So you could be getting other people sick without knowing it. That's why when there are a lot of cases of COVID 19 in an area, leaders recommend staying home unless you really need to do something, like get groceries. And if you are feeling sick, stay home and call your doctor. What are COVID 19 symptoms? Some signs of being sick with COVID 19 are a fever, cough, body aches, and trouble breathing. Some less common symptoms of the virus include headache, sore throat, runny nose, problems with sense of smell or taste, nausea, and diarrhea. I know it can seem like anything can be a symptom of the virus, so if you aren't feeling well, stay home and call your doctor. Most people who get the virus will experience mild symptoms. Some people won't experience any symptoms at all. Most people, including children, who get sick with COVID 19 can recover at home. But for some people, especially people who are 65 and above, people who have other health problems like lung conditions, diabetes, and heart disease, and for people whose immune system or infection-fighting system doesn't work so well, COVID 19 may lead to more serious problems that require hospitalization. What should I do if I'm feeling sick? If you are feeling sick, have a fever, cough, or are having trouble breathing, call your doctor or local urgent care facility. This is important. Call first. And if you are sick, cover your nose and mouth with a cloth mask, scarf, or handkerchief. It will help protect the people around you. If you live outside the United States, check with your National Health Agency on mask recommendations. When you call, your doctor can tell you what to do next. Some people may need to come in and be seen by a doctor, and some people may need to stay at home and limit their contact with other people. Your doctor can tell you what you should do. What should I do if I'm worried I've been exposed? Your chances of exposure to the virus that causes COVID-19 increase if you are within 6 feet of someone who is infected, about the length of a bed away from them. You live in or have traveled to a location that has a lot of cases, or you were at a crowded event with someone who is infected, like a party. If you think you've been exposed to someone who has COVID-19 but aren't having any symptoms, call your doctor, hospital, local urgent care facility, or public health office. They can tell you what to do next. If you think you might have been exposed and you have symptoms like fever or cough, you should call before going to your doctor's office or to a hospital. Your doctor can tell you what to do and if you need to be seen in person. If you are asked to come to the hospital, you may be asked to follow special procedures, like using a special entrance away from other people and covering your nose and mouth. It's important to know that currently there is no proven treatment for COVID-19, but doctors can help support your breathing and make you as comfortable as possible. Most people will not need to stay in the hospital and will be able to make a complete recovery at home. What can I do to stay healthy? Wash your hands with soap and water. Really, I know it sounds simple, but it has a big impact. Basically, it's because soap breaks apart the container that holds the virus. Once the container is open, the virus just washes away with the water. For this to happen, you gotta spend some time washing your hands, and you need to scrub. You want to wash your hands for 20 seconds. That's the happy birthday song 2 times. You'll want to rub your hands together, clean your wrists, fingernails, in between your fingers, and dry your hands with a paper towel you can throw away. Lastly, turn the water off using the paper towel instead of your hand. Now, if you have kids in your household, make sure they're washing their hands this way too. If you aren't around soap and water, use hand sanitizer that is at least 60% alcohol. Make sure to rub it in until it's dry. What else can you do to stay healthy? You'll want to keep your distance from other people. This is called social distancing. And you really want to stay away from people who are visibly sick or coughing. If you can, work from home. And speaking of home, clean surfaces that you use frequently. Clean doorknobs, countertops, your phone screen, and other items you touch a lot. Lastly, it is a good idea to limit travel to places that have a lot of COVID-19 cases. Okay, let's talk for a quick minute about what doesn't help protect you against COVID-19. It doesn't help to hold your breath if someone sneezes or coughs around you. The virus can be passed in multiple ways, so not breathing around people doesn't really do anything. Let's also talk about masks. If you live in the United States, check cdc.gov/COVID-19 for the latest recommendations on masks and face coverings. If you live outside of the United States, check who.int or your National Health Agency for recommendations. How can I help slow the spread? I know COVID-19 sounds scary, but there are some good things to keep in mind. For most people, COVID-19 is a mild infection that is not life-threatening. You can do a lot to keep yourself and others healthy by washing your hands, staying away from people who are sick, wearing a face covering, and practicing social distancing. Remember, if you are feeling sick, stay home and call your doctor. By taking these practical steps, you can protect yourself and those around you, and help slow the spread of the virus. And you can stay up to date with the latest guidelines and recommendations at www.who.int or your national health agency.
So I will say, I just want to say before we move on, that video, out of all of the videos that I seen on YouTube, there are hundreds and hundreds of different videos that are similar related to COVID-19 and the prevention of the virus, the prevention of the spread. However, that one I felt like was great to encompass all that is relevant even to today. Because if you notice, the video actually is from April of 2020. And as we know, a lot has changed since April of 2020, but actually everything depicted in this video is still relevant to the guidelines and everything that we still adhere to today, which we are now the end of January of 2021. So I just wanted to state that I really wanted to share that video, embed it, and incorporate it in this presentation because it is a great depiction of some of the guidelines and some of the things and questions that a lot of people still have regarding just the basic virus, let alone now moving forward, going into maybe coming up on a year of this virus being here now, having to experience now the new variants that are here, as well as now having some treatment options available to us, such as the vaccines. So I just wanted to share that. I thought that was a great video. And I will include the links that I have embedded in my slides. I'll include those links under the description of this video. So again, this was covered in the video, but it's just a quick overview and highlight of how the coronavirus COVID-19 is spread. To the left of your screen, you will see a little chart and says efficacy of face mask. So the top mask is an N95 mask, and as you see, it's 95% effective protecting us from COVID-19. However, with the N95 respirators or face masks, you really should be fitted to make sure you have a proper fit. They come in different sizes. I know I work in healthcare. However, if you do not work in healthcare and cannot get the proper test done to make sure you have the proper fit, you definitely want to place the mask on your face. You really do not want to have any facial hair on when you're wearing an N95. You want to have the most snug and tight fit as possible. You want to make sure that it's fitted well around your nose and that you adjust that. And then you want to try and breathe to see if you feel any air coming on the outside. However, when we do get our tests done in healthcare facilities, the tests are done slightly different, and you wear a hood, you put the mask on, and they spray a solution inside the hood to see if you can taste it in your mouth, because that would show that even the tiniest little opening that could put you at risk for being exposed. And then we have a surgical mask, which is 89% effective. And then we have our regular cotton fabric reusable masks that are 50%. And these, I would highly suggest that you frequently wash these, clean them, air dry them, and try not to just reuse it day after day without cleaning them thoroughly and drying them properly. So as we see, some of our just highlights, and these are just some of the bullets for how the virus is spread, and we just saw it in the video, but it seems to spread more easily than the flu virus, influenza, and it causes more serious illnesses in some people. COVID-19 spreads very easily from person to person. It's most commonly spread during close contact, so that's why we have social distancing. It can sometimes be spread by airborne transmission. So again, if someone is coughing or sneezing and they're not using proper etiquette with coughing into their sleeve or sneezing or even having their mask in place when they do these things, the spores, the droplets can go into the air and thus putting people at risk of now that virus being transmitted through airborne transmission. It spreads less commonly through contact with contaminated surfaces. However, that is a source that you can get the virus. If you touch a source, if someone just coughed or sneezed and then they touch a surface and that surface hasn't been cleaned, or that virus is sitting there and is recent, you can touch that and then go ahead, touch your face or any opening on your body, and that is a way of transmitting the virus. It rarely spreads between people and animals, and you definitely want to protect yourself and others. So by wearing your mask, your face mask, you're definitely not only protecting yourself but also others. So there are a lot of different symptoms associated with COVID 19. As the virus has progressed and spread, we have noticed patients presenting with so many different signs and symptoms, as well as no symptoms at all. So, people with COVID 19 have had a wide range of symptoms reported, ranging from mild symptoms to very severe illnesses. Symptoms, they can appear 2 to 14 days after exposure, and people with these symptoms may have COVID 19. But as we see, a lot of these symptoms can be related to a vast amount of other illnesses that we know of, such as the common cold, influenza, even gastrointestinal viruses. So these symptoms can be just about anything. However, it could also be COVID 19. So if you're experiencing fever or chills, a cough, shortness of breath, or difficulty breathing, fatigue, which is tiredness, your body is just feeling very tired and fatigued, muscle or body aches, a headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. These are signs and symptoms that you may have been exposed to and may have COVID 19. Or these could be symptoms related to another illness. So it's very important that you pay attention to your body, the symptoms, and contact your provider. So, treatments. Currently, there are no proven treatments or no cures for COVID 19, but there are recommended treatments for respiratory support and care of viral symptoms, such as we seen on a prior slide, you can take a over-the-counter medication to help treat maybe a cough or a fever or a runny nose. Antibiotics, and the antibiotics are only recommended and should only be used to help treat a diagnosed infectious pneumonia, or if you have an infection somewhere. So if you do not have an infection, then it's not recommended that you get prescribed an antibiotic because it's not going to work. As most of us know, but in healthcare, we all know that if you have any type of virus, viruses have to run their course, and their course can run up to 14 days or longer, but viruses have to run their course, and you may have to be prescribed certain medications such as antivirals. However, an antibiotic is not going to work for um, a virus. Certain medications that can be prescribed to help some of your symptoms if over the counter medications are not helping. You can have a cough medicine that's prescribed, maybe some steroids or some inhalers. So it's a lot of different treatment options just to help with symptom relief and to help manage the virus. And then you have medications administered in a controlled setting, such as a hospital setting. And some of these medications that you may be hearing, especially related to COVID 19, is remdesivir, and that's a broad spectrum antiviral medication. Each patient that receives this medication first has to be evaluated and seen by a doctor to make sure they're a candidate to be eligible to receive this antiviral. Oxygen and mechanical ventilation for respiratory support. This again is provided in a controlled setting, such as a hospital setting, and this helps with symptoms of shortness of breath and those having difficulty breathing. And more recently, one of our more recent COVID 19 treatment options are now vaccines to help prevent everyone from being exposed to getting COVID 19. There is a link here. Again, I will make sure all of these links are located under the video, but this link is directly to the CDC, and it discusses all of the available vaccines to date and their clinical trial information, as well as effectiveness and so forth. So it's a really thorough comparison chart of the different vaccine options. I suggest that everyone schedules an appointment with their provider prior to getting vaccinated, just so that your provider can let you know if you are a candidate to get the vaccine, because everyone has different backgrounds, health illnesses, or chronic illnesses or diseases. So it's just good to have that conversation with your provider to see if it is recommended that you get the COVID-19 vaccine. And if so, your doctor will be aware that you received the vaccine and they can update your medical records at their office. So the update for COVID-19. So back in December, we were told that it was two vaccines that could be approved for use in the United States. However, right now, as I mentioned, I am in the end of January of 2021. And in fact, those two vaccines are already out. They've been distributed, and millions of people have already started receiving their first, and many people have already received their second doses. Those two vaccines are Pfizer and Moderna. So it is reported that there will be 2 to 3 more vaccines that will be available to us in the near future, such as vaccines made by Johnson & Johnson, as well as AstraZeneca and other pharmaceutical companies. Again, this link right here, I will make sure it is available under this video, where you can refer to these links on updated information regarding all of the vaccines that have been approved for use in the United States. So, what is this new variant we are hearing about? So, the COVID-19 variant, as many of us may know, viruses constantly change through mutation, and new variants of a virus are expected to occur over time. And that's what every virus, not just COVID-19. All viruses can mutate and they can break off and have new variances. Sometimes new variants emerge and then they disappear. However, other times new variants emerge, but then they persist. So multiple variants of the virus that causes COVID-19 have been documented in the United States and globally throughout this pandemic. So what does this mean? What does this mean? This means for all of us globally, whether you work in healthcare or not, that all of us need to adhere to and continue to protect ourselves with measures that have already put in place, such as wearing our masks, socially distancing, hand washing, and or using hand sanitizer, cleaning and disinfecting our homes and workspaces, and if you are a candidate and or eligible, get vaccinated. So although millions of people are starting to get vaccinated, this is not the time to kind of decrease and lax on the measures that we have in place to help keep us all protected and help decrease the spread of the virus. But we have to maintain these measures because now we have variants that are out there, and we need to make sure we all remain safe and help decrease that spread of the virus. So right here, I have included, I live in the state of Delaware. However, I am from the state of Pennsylvania, as well as work in the state of Pennsylvania. So I wanted to include information for the tri-state area. There have been several people that have stated they did not know where to go to get information on what phase each state was in as far as administering the vaccine, and or how to sign up and go about getting the vaccine. So I just included some links directly to each state's Department of Health websites where you can get information and where you can sign up to get vaccinated, as well as find out what stage or phase that each state is in. So the first state I'm going to start off with is the first state, the state of Delaware. So right here, here is a website, and again, I will include the links underneath this video, but I just would like to show you and navigate with you, just show you a brief overview of what you will see when you click on this link. So as it's pulling up this website, I will tell you that I did go through this process. I work in healthcare, so I was able and blessed enough to be able to get my vaccine through my facility of work. However, I did have to go through this process with my mother to get her signed up and registered for her vaccine, which she just received actually today. So as soon as you click on this link for the state of Delaware, the first page you come to, and of course, every time you click on this link, it'll be the most up-to-date information. So right here, it tells you that the state of Delaware, they will begin the phase 1B of the vaccine distribution. And that phase 1B includes people 65 and older and some others, and you could get more information. But that phase began in the state of Delaware on January 20th. So now we're in the end of January, and 1B is progressing and moving right along. And those in the state of Delaware that falls in the category of 1B have already started receiving their vaccination. So that's awesome. So right here, when you click on this site, you want to navigate and you want to read the most up-to-date information, which is typically right here on this first banner. Like as soon as you get on this site, it tells you right here if you would like to get tested, if you want to look for a testing site or area, you can click right here on this link right here. And if you want to find out more information about the COVID-19 vaccines, they do have an 800 number, a call center with their times that they're available. They have a separate site. You can send an email. You can send an email right from here, from this site. And then right here, this is the website, and this is the link that I went to when we signed my mother up. But you just click right here where to get vaccinated. And it just really prompts you through. It's a pretty straightforward process. It's not too hard to navigate. Again, if you know someone that may need assistance with navigating the web and just going to the site and getting signed up, by all means, please offer assistance, because for some people it can be a little overwhelming. So right here, where can I get my vaccine? So as you see, Delaware has it right here. It's so easy to understand. They have phase 1 already started, and that started mid-December, but we're already in phase 1B. So phase 1A already started, and we're in phase 1B. So that's great. That's great. We're moving right along. So it tells you, because if you're like, well, what are all these phases all about? It tells you right here, we are currently in phase 1B, and it tells you the eligibility and who falls under 1B. You have right here facts at a glance. And in phase 1B, see below to find out where you can get the vaccine. So this is where we came to sign my mother up for her COVID-19 vaccine. So this is great, because all you have to do, if you want to learn more and see, if it's any big vaccination events, you can click on here. And that's a lot of those larger events where you can drive through. I know one of the locations is the DMV, the Delaware Motor Vehicle Facility, which is in Delaware City, Delaware. I know they were having a vaccination event there. Now, it may just be certain times and maybe offer different days, but this is where you would click to see if it's any large events. If you want to see which doctor's offices, if any, are taking part in vaccinations, you would click here. However, I will show you where I went. I went under pharmacies. I just felt like it would be a little easier to find chain pharmacies that are offering the vaccine. That way we would have more of a possibility of getting my mom her appointment for her first vaccine. So this is where you come to as soon as you click on that. As you see, Walgreens, and it tells you the type of vaccine that they are offering for pharmacies vaccinating persons 65 and older only. So the Walgreens chain in Delaware, the Rite Aid chain in Delaware, and then this particular pharmacy is located in Camden, Delaware. All of them are offering the Moderna vaccine. Then you have down here, you have Aspira Health, they are offering Pfizer vaccine. And then you have right here the pharmacies located in the giant supermarkets. They are offering Moderna. And then you have only a handful of pharmacies located in Walmarts. You have the locations right here, but it tells you they're offering Pfizer. So this is a great source to go to if you just want to start to find out where, in fact, you can get your vaccines and what vaccines they are offering. So I'm just going to come out of here. I'm going to go back, and now we're going to look at the state of Pennsylvania. So how to get tested for COVID-19. These are just the test sites. However, when we click on this link right here, this link is going to take you to where you can sign up to be vaccinated. And similar to Delaware, we will see what phase that Pennsylvania is currently in. And this is important because every state is not in the same phase right now. So for those who are living in the state of Pennsylvania, this is actually information. You may see it on the news, but I would recommend you checking these links, if not daily, every other day, because once they do slide into each phase, such as 1B, those appointments will probably be taken pretty fast. So as you see, this is the first page when I click on the Department of Health for the state of Pennsylvania for coronavirus vaccines. This is the first screen that I come on. When I come on this screen right here, it says get vaccinated. So you could click on here. That means you want to start the process of getting vaccinated. Pennsylvania, their plan. So that's all the phases and when they plan on rolling it out. Vaccine distribution, the safety before your vaccine, frequently asked questions, vaccine resources, and insurance coverage. So all of these links, you can click on each of those to get more information. Right here, it shows you that Pennsylvania is currently still in 1A. So remember, we were just on Delaware's website and they are now in phase 1B. But Pennsylvania, as of January 28th, 2021, they're still in phase 1A. So this is important to know because you want to be prepared. If you do know you're eligible and fall in the category of 1B, you want to be prepared to go on and sign up. So you have to have all your facts straight before you sign up. So now would be a great time to look at all of that. So when am I eligible? Where can I get vaccinated? Vaccine frequently asked questions and so forth. These are all links again, just like up top. You can click on here. So if you wanted to know which category do I fall in, I'm not even sure. So the current phase they're in is 1A. So it tells you all the people, all of those who fall into this category. So you can see if you fall into any of those categories, if you would be eligible to receive the vaccine now in phase 1A. If not, you can look ahead to see, I wonder if I fall in the category of phase 1B. What does that entail? So you definitely want to look at the category and the eligibility criteria for 1B. So that's right here. Now remember, this is the state of Pennsylvania. Phase 1C, you have this other category. You have all different types of workers and different entities. And then lastly, phase 2. Okay. All right. So hopefully this is helping you guys. I know, some people are, they're good to go. They're pretty good with navigating and getting things done. But hopefully this will help at least one person, at least two people, because I know it can be very overwhelming. You don't want to fall through the cracks. You want to get as much information, read up on the vaccines as much as possible to see if that's something that you think you may want to get. Again, I would strongly suggest you talk with your provider especially to get more information if you just feel like you don't have enough information, or you're reading a bunch of information and it just doesn't make sense to you, or you don't know what that information means. You definitely want to utilize your healthcare provider where they can explain this to you, where you can better understand, and maybe they can assist with answering some questions, and maybe not. But I will tell you, all of us are learning as we go, and we're just going directly to the resources, and we're reading as much information as often as we can, because we know more and more new information is coming out almost daily. And it's going to not only affect our practice clinically, but it's going to also affect us in our lives and our living. So I just suggest, honestly, as a layperson, as someone maybe not, immersed in this information and immersed in healthcare, I would suggest that you just help one another. You can look at the information on news outlets, but also just take your time and maybe navigate and go to your state's website or even the CDC and just begin to slowly digest the information. And a great source would be the frequently asked questions page, and that might help you feel a little bit more at ease when it comes to making that decision of if you should get vaccinated and when. So lastly, the last date that I got the link to be able to see when they were going to offer vaccines and so forth and where you can get vaccinated is the state of New Jersey. So again, I will provide that link, and I'm going to just show you when you click on New Jersey's Department of Health website. This is the first page you'll come to. It's slowly coming up. Here we come. And then right here, COVID-19 information. And look, this is how often they change these websites. Like, I was just on here. I presented the same presentation last weekend. And from the time I presented it to now, almost daily, the information has been updated. So that's excellent, right? Because you can have this one link and know that every time you just click on that one link, you're going to get the latest and greatest with updated information. So right here, it has today's date. It says COVID-19 is still active. Yes, it is. Wear a mask, social distance, stay up to date on vaccine information. So the state of New Jersey, they have a bunch of resources right here on this banner as soon as you click on. So if you want to call the call center, or you can even send a text. Look at this. You can send a text. You can visit this site, which we are on, called 211. Vaccine appointment support. So if you need help or support with making an appointment to get your COVID-19 vaccine in the state of New Jersey, right here, you can just click right there and it'll lead you and guide you. So right here, it tells you as of January 14th, the following groups are eligible for the vaccine. So right here, these are all the people in the state of New Jersey that are eligible right now to get the COVID-19 vaccine. Isn't that amazing? So that's good. So right here for New Jersey, their website, if you want to learn more or go to the next page for a list of open vaccination sites near you, or you want to register for the COVID-19 vaccine, it tells you right here. It says to click covid19.newjersey.gov/vaccine. So this little banner right here is covering up everything. So, okay. I'll go back here. I'm going to hit on learn more. I think I navigated this before. New Jersey wasn't too bad. They're all pretty much user friendly. As far as just leading and guiding you to how you go about finding, vaccine sites, your eligibility, and so forth. So here it is. So here's the same front page that was on the website. They just put it in like a PDF file. Is this hyperlinked? This might be hyperlinked. Yeah, so that's hyperlinked. So you could just click right on there. It'll take you directly to New Jersey's locations to receive the COVID-19 vaccine. So first of all, they have for you to click here to even see if you're eligible. And then right here, New Jersey has registered for a vaccine on the New Jersey vaccine scheduling system. And right here it says, and you will be notified when an appointment is available to you in the system. So that's good because then you could just register yourself and just wait for someone to call you and they'll just get you all set up over the phone. Or you could look for locations and look what they have, mega sites. So this is perfect because the mega sites, they tell you the county that is in New Jersey, where it's located, the minimum age to receive it, and then the facility's website. So you can go directly there, see pre-register. So a lot of these you could just click right on pre-register and then you just show up on that date and time and then you're already pre-registered. So when you give your name, they'll already be waiting for you because you've already pre-registered. So here are some of the mega sites. So it's a long comprehensive list for the state of New Jersey. So this is pretty cool. So that's the information we have for the state of New Jersey. Again, I hope that this information I share, like I said, hopefully it'll help at least one person. I just try to do the best I can. I do have people separately will inbox me or text me or so forth, asking just my personal opinion. I am a registered nurse. My doctorate is in education. I'm a college professor and I work in a hospital as well. However, I base my information just off of, again, I'm immersed in this in healthcare. This is what I do. However, if I can in any way lighten the load for a layperson or look up the information, provide links, or just let them know, share my experience. Like I was very open and share my experience when I received my first vaccine as well as my second vaccine, just to let people know, like, hey, I scheduled an appointment with my doctor prior to getting the vaccine. I just wanted to make sure it was safe for me to be able to get this vaccine due to some of my health history. So I just wanted to share my experience of if I've received the vaccine, if I experienced any side effects, what they were, how long they lasted, and so forth. And by me sharing my experience, a lot of people say, thank you so much for being open and honest and transparent, because it's almost like no one is really explaining on our level where we can understand. We don't know what this means. And we're a little apprehensive of getting this vaccination. Like, is it safe? And we don't know anyone who's received the vaccine to be able to share certain information. So, again, I just try to present just a little bit that I know of and that I could share. Again, we're all constantly getting information from not only our workplaces, but from the media, and then looking up information on our own. But I just wanted to help lighten somebody's load and be able to, do some of that background work for you. And again, be able to provide these links where you can just click right on some of these major links, such as the CDC. And of course, it is more specific for the tri-state area, but you have Delaware, Pennsylvania, and New Jersey, the information for getting vaccinated. So take care, and I hope this helps somebody. Please be safe and continue to wear your mask and socially distance, and of course, use hand hygiene. Bye.